I will smoke up to do XYZ. For me to do this, to eat, to sleep, to focus on a project, I need a substance in order to perform. Medical providers wear burnout like a badge of honor.
Yes.
That's the reality. I know exactly, even medication-wise, I can self-medicate very efficiently. I know how to not just intellectualize the problem, but also perform when I come to therapy.
And if you come ready to perform, there's not much I can do for you.
True.
But then also we have to work with shame in a very careful way, because high functioning and highly excellent people, they have shame around vulnerability. There is the fear of cancel culture. We can, like today, we can just cancel you.
Exactly.
For one small
just
little
because
thing.
I say one small thing.
Exactly.
Yeah.
So you live a very well choreographed, managed life.
Hi everyone, and welcome back for yet another episode of Circling the Rabbit Hole podcast with me, Dr. Claire Kinuthia. As always, to begin with, I'd like to thank our location partner, that's Ashley Furniture Home Store and Fair Deal Furniture, for continuing to host the podcast. We are really enjoying our current home. So this episode is directed to me, my guest, and high-functioning professionals like us. So it's going to be one that really hits home. It's something that we tend to like to sweep under the rug, or circumstances of our work, our professional lives, our social lives force us into. And that's all the mental health issues that affect high-functioning professionals that are easily masked with coping mechanisms that are not healthy. So we're going to look at high-functioning depression, anxiety, social struggles like substance abuse in order to cope with some of the strains that we have in our workplaces, and how to face or fight against the isolation and the shame that comes with suffering from a mental health illness when you're supposed to be performing at maximum, when you're supposed to be showing up. When I look at medical providers especially, a lot of us fall under this category where you're supposed to show up and look after others who are having physical and mental struggles and help them repair, fix, heal, get back to being healthy. But yourself, there aren't any avenues for you to deal with the struggles that you may be facing yourself, whether they're physical struggles or mental struggles. So this is one of those episodes where I'll ask you guys to just grab a lovely cup of whatever it is you enjoy to partake, and a notebook and a pen. And if something registers or strikes home for you, feel free to reach out to Mwari or to your therapist so that you can start to work towards the road to recovery. So, because you're not new here, but we also sometimes have new members of the audience, please start by introducing yourself. The gorgeous, the stunning. She's always looking like a peacock. She arrives here looking like a... But I have to step it up. It tends to be, by the way, the brief with Babu. When I say Mwari, he's like, okay, color.
Oh, didn't know that.
Because immediately, Claire, we're putting you in color. And I'm like, yes.
Now I know.
So please,
Thank you.
as is the tradition on the podcast, please introduce yourself and tell us what you do in more professional terms than I have, and where we can find you on socials.
All right. My name is Mwari Muthaura. I'm a clinical psychologist. I work, my practice is called The Simple Self. You can find me on Instagram as The Simple Self Therapy. I mostly work with professionals in the corporate world, in business, in entrepreneurship. A lot of my work is focused on high-functioning professionals,
That's
actually.
why I was like, this is the perfect conversation for Mwari.
Yeah. Especially women, actually.
Right.
Neurodivergent people who are expected to be high-functioning and working through psychotherapy, but in other forms, modalities that are not just talk therapy. I'm also a jewelry designer. I design and make jewelry.
Yeah.
I'm a plant junkie, so
Yes,
I
you
garden
are.
all the time.
Yes, you are. You live in a forest, so.
Yes. So basically, that's it about me. I work in a lot of trauma-informed work. I try to incorporate trauma-informed therapies for people who, especially therapy in the conventional sense, hasn't been very helpful to them. Yes.
Okay. So to go straight into the conversation, what are some of the common issues you've seen with people like us? We're saying high functioning, and by that I mean you're in a very demanding career,
Yes.
but you're not struggling. You are actually looking like you are thriving in the chaos. You have short deadlines, high demand on workload, but you're producing. You're actually very productive. Some of us actually thrive. There's a thrill that comes in, I have a tight deadline that I have to meet, and I met it, and you procrastinate till the very last second, but you still deliver top-notch
Yes.
on your deliverables. So what are some of the common issues you've seen that we're struggling with, or we are refusing to face or cope with?
Yeah.
Maybe you can direct us there.
Yes. And in today's world, we have the hyperfunctional professional, actually. And we take it as a personality trait. We'll say, that's Claire's personality. But it's not your personality.
Right.
Your nervous system has just adapted that way.
Right.
In order to cope, you keep going and going and going, because also we don't want to be seen as failures,
Exactly,
right?
yeah.
So there's a lot going on. There's a lot of digital exposure. There's financial pressure. There's the fear of cancel culture. We can, like today, we can just cancel you.
Exactly.
Over one small
just
little
because
thing.
I say one small thing.
Exactly. So you live a very well choreographed, managed life. You said we are thriving, or you're not struggling.
Yeah.
But no, it's not struggling. You do not look like you're struggling. You look
Exactly.
very well put together.
Yeah.
That's what it is. So, the whole, you've seen a lot of, what do you call them when you have the imagery to depict something, not a chart? Let's say, like, if I want to show you something using a metaphor.
Right. Okay.
And we talk about the iceberg, right?
Yeah.
And so what we are seeing is the tip. And on the tip we have outgoing, detail-oriented, high functioning, helpful.
Yeah, successful.
Exactly. Loyal, organized.
Yeah.
There's a lot. High achieving.
Yeah.
Did I say outgoing?
Yeah. You have
There's
the
a lot of
perfect
that.
home, the perfect. You look amazing every time you leave your house.
Exactly. Flexible.
Yes.
Strong one.
Yeah.
The one who can handle all the pressure.
Your family looks well put together.
Exactly.
Your life looks like cookie cutter, literally. Yeah.
Yeah. But then we all know that's just the tip, what we see. What we don't see underneath is the thing that's going to sink that that ship. Mount Kenya tongue came in there. And what we don't see is the burnout, the racing thoughts, the sleeplessness, the numbness, the fear of failure, the isolation, the loneliness, the irritability, the overly criticalness, if that's a word, of self, always having to-do lists, trying to achieve the impossible, thinking of the next thing, not wanting to be seen as someone who did not succeed. Like, there's so much going on underneath that people don't see. They just see what's up here. And so because of that, nobody thinks to reach out to you and ask you how you're doing.
True.
In fact, isn't that the common complaint? People don't ask me
Nobody
how I'm
checks
doing.
in. Exactly.
But they'll call me and go straight to what they need and how they're doing.
Yeah.
Right?
Yeah.
So there's a lot of that, this hyperfunctioning thing. And what you end up seeing is, especially, we talk about high functioning anxiety, right? Which is not like a diagnosis. It's not a clinical diagnosis. It's a way to describe an individual's experience with anxiety, where someone will look put together, successful, highly capable, and then secretly struggling with things.
Right.
And how you know, and this is a thing with many professionals, I'm sure you and I included, is the over-preparing, right? Before something, you over-prepare.
Yeah.
There's perfectionism. There's procrastination. There's overthinking. And overthinking It's overthinking conversations you've had with people. You replay them.
Yeah.
You go through your messages over and over and emails before you send them.
True. You'll
Right?
even dream repeatedly about something you're anxious about or feel unprepared for, and you'll keep interrupting your sleep, and you'll get up and you'll read notes, you'll prepare, and then you go back to sleep and you're like, but. So
Exactly.
you have a disturbed sleep cycle even as well.
Exactly.
Yeah.
Then there's chronic tension. There's imposter syndrome, which a lot of people have. There's the being overly critical of yourself and your work, even though everybody's happy with it. There's being afraid of failure, the never-ending to-do list. Your life is busy with task after task after task. You feel guilty when you rest. Like a lot of people will not just shut, right?
Yeah.
The feeling that you have to prove yourself to other people. It's a very common thing. Even when you're successful, right? You think about your family, you think about what your siblings are doing that looks more successful than you, and then you want to also show you're capable. The trouble saying no. You say yes, even when you're overburdened already, and then you have difficulty switching off. You're always looking to do something. You can't stop to celebrate your achievement.
Exactly.
So you conquer one thing today. We don't pause to celebrate it. You're already thinking about the next big thing. Also difficulty accepting compliments. So a lot of people look like they're okay, and what I've described sounds very normal for a lot of people, right? But that's not normal. That's high functioning anxiety. And then other things you see, especially with people who are really high functioning and successful, is the depression. But people do not always know they're depressed because people think depression is sadness. But that's barely a symptom that people see, right? There's numbness, there's loss of joy, to the point that when I ask, what do you do for joy? You're like, you know, what do you love to do? I work all the time. So, and you're working.
My work is my joy.
Exactly. But you're also working to avoid feelings, right? And then there's always, you'll see irritability, but it's mislabeled as stress. When you hear someone, what's up? They say stress. But then they're always irritable, or they're always on the edge, right? Some quiet hopelessness. And you can see it with a lot of professionals. Their work is going on okay, but when you start to talk to them, you tell there's a lot of hopelessness,
right.
But it's not so pronounced. And that's why we have the whole masked suicidality. Like when you talk to somebody, you realize they've been thinking about death a lot, or wanting to not do this anymore, or not wanting to be here anymore. But because they look like they're holding it together, that's something that's easily missed.
Right.
And then one day you get a memo within the corporation you're working that so-and-so is no more. And the story later emerges that they ended their lives, right? Like they died by suicide. So this happens a lot because your functionality hides your suffering. But there's also burnout. That's the one we all know. We talk about burnout a lot. I'm just burnt out.
Medical providers wear burnout like a badge of honor.
Yes.
That's the reality.
Exactly.
Yeah. And actually, I think we also rewarded. There's a lot of praise.
Exactly.
Like if I said to people, I worked 36 hours yesterday, they're like, it's impressive. Oh my goodness.
She works so hard.
It must be so rewarding.
She's industrious. Exactly. But now, burnout is nervous system depletion. And we don't address it enough because we have an idea of what it is, because, there's cynicism, there's brain fog, there's reduced empathy, there's chronic fatigue, there's feeling trapped. But burnout isn't always in the way we think it should be. We all know something about the overload burnout, right? So the overload burnout is where you're working so hard, you're exhausted physically, you feel the tension, you literally run down. That one we are all familiar with. In fact, I'm glad we know about that one, because
that one we can identify. We're actually good at identifying.
Exactly. Likely someone can do something, order you to bed rest. I mean, if it's really bad, you can even get admitted in hospital. That one we can recognize. But there are other kinds of burnouts that are easily not recognized. So, for example, there's under-challenged burnout. Okay? So you're at work, but you're not growing.
Right.
Work has lost meaning. you feel like you're not serving any purpose, you're not growing. It's always ignored. In fact, one of the leading causes of depression amongst professionals is that one. You have stopped growing. And as with all living things, you need to grow, you need to learn something new, you need
to have
skill.
A challenge.
Exactly.
In the workplace,
Yes. But you'll see a lot of people who actually end up in some form of self-destruction. They are idle and bored and have nothing to help them grow. Right? So that burnout, it feels like languishing, and a lot of people get depression because of that. But people don't recognize that as a form of burnout.
As a form of burnout.
And then we have under-challenged burnout, which is where you feel like it's like a learned helplessness at work. No matter what I do, it's not going to help. You also feel like the people who you're working for or the systems you're in, because of how dysfunctional they are, nothing you do will make a difference.
Right.
Actually, a lot of suicide cases, they'll fall under that amongst professionals, because you feel so helpless to the point that why bother?
Right?
Yeah. So when people talk about burnout, I want people to stop just looking at burnout as the one where you're tired and depleted.
Exhausted,
Because that's a word that's been overused. In fact, sometimes it's misused. But there are other forms of burnout, and a lot of us fall under those other categories, but we do not recognize. So when you're overloaded, you're always in hyperarousal. You've been working so hard, but then now when you're under challenged, it's like you're in this freeze state or emotional disengagement. And then when you're going through neglect, it's almost as if you have this learned helplessness response. So those are some of the things I think people need to understand. So when you're talking about some of the things that high functioning individuals go through that affect their mental health, those would be top on my list. And I know a lot of people will keep pushing themselves even when they've reached the point of exhaustion, because the fear of failure is actually it's debilitating. Actually, you'd rather die than be seen as a failure.
Exactly.
You fear judgment. You do not want people to cancel you. So for example, if you have to handle something really big at work and you have to make a decision, and in this era where everybody goes on social media to out people, and then you just get cancelled over something that is one side of the story. So you'll find people getting stuck in the emotional states because you're like, this way, if I go this way, I'm doomed. If I go this way, I'm doomed. So how do I make a decision, within my best interest? And then they get stuck over there. So despite outward achievements, you feel like you're never doing enough. You're constantly seeking external validation. And that's how high-performing people sort of get by without us seeing how they're struggling.
How do we get here? Because is the question I have that comes top of mind is this something that I was taught along the way?
Okay.
Or is it something that's being caused by factors around me? So as a professional, because if I speak to medicine, some of this abnormal coping, not even coping, but like dysfunctional working dysfunctionally comes from the training in medical practice, so that you're taught sort of to neglect self in service of others.
Yes.
And you actually also have no support. So if you actually spoke up about feeling sad or depressed or feeling like you're overwhelmed at work, the response would be punitive rather than supportive. So I can see that there's my environment causing issues.
Yes.
But is it also partly who we are? Like you said, it's not a personality trait, but then some of us, type A, is more what's the word I'm looking for? Predisposed compared to others. Those are the questions that come top of mind.
But you do know, like, I wouldn't discount personality quite entirely, because you do know when you're growing up, you're like, if you're a firstborn, yourself, you're a firstborn.
Firstborn daughters, stand in front here, please.
I know. And we see all these memes that say things like firstborn daughters are the strongest men we know. We laugh about it, but do you see how harmful it is?
Right.
Because there's what in our society we know a strong man to be. And then there's expectation we have put on you, for example, as a firstborn daughter, which means chances of being parentified are real. Chances of picking up, like you've grown up picking up slack, like cleaning up after everybody, being the one to look out for everybody. If a parent looks stressed, you're the one to read the mood and, alert the rest of the pack, you know. We even say deputy parent as if it's a badge
like
of
a badge
honor.
of honor, yeah.
It is not, by the way,
Yeah.
because it's not your job to parent your siblings. But in our society, it's something that's considered normal, right? The same way we are saying some of the symptoms we're talking about in high functioning anxiety, we consider them normal. People will say, isn't that normal, right? So when we are growing up, our early caregivers gift us these wonderful personalities based on how love and work and things were done at home, how discipline was done, some of the messages you learned. We hear people say, go big or go home. As if going home is an issue, right? Or as if there's no middle ground. There's the whole, do or die. And we've seen, even recently here in Nairobi, we've seen cases of people who have appeared in what do we call the top 40, what do you call them? 40 under 40 or 30 under 30, whatever. All these people who are succeeding and we get to know them. Like if I didn't know you and I see you on the paper and I'm reading about you, now my interest has piqued and I'm reading about you. So admirable, so young and has done so much. Then months later, there's a headline and it says, so-and-so falls to their death. And even people who've been on Forbes lost their lives. How do we get there? The pressure is so high that even succeeding sort of sets you up that you cannot be human and you cannot be vulnerable in addressing the things that you're struggling with. You're up there now, you're like, I have to carry this image. My relatives already know this is what I'm doing. Some people have already said I might not succeed, so I have to prove them wrong. And then there's a lot of things going on with the economic situation right now, financial crisis. There's fear of certain generations. You're fearing Gen Zs, okay? Because their way of giving information is different from what our generation does, for example, or students. Like the thinking is different. Even parenting these people is different, and we're not catching up enough. So over time, that burden is so heavy, and people tend not to share, right? And by the time someone is reaching for help, sometimes it's a bit too late. Like it's built up so much that now they're having a breakdown. Or some people even have breakdowns at their place of work, and we don't know that's what's happening. You just say, Claire yells and throws papers and things at everybody, and nobody is seeing that as some form of mania, temporary, but happening. We just say it's normal. So how we get here is because society expects so much from you if you're high functioning. Depending on your birth order, people also expect so much from you. The people who are like top in the family, birth
all
order.
All eyes on you,
all eyes are on you. If you're a middle child like me, you could get by. I know. I'm like, if my siblings are watching this, they'll be like, But it's true. And then if you're the last born, maybe it's a little pressure, but, keep up with. Try and keep up. So there's so many dynamics at play. Then when you're a brilliant kid and outgoing, we make you a prefect in school. You oversee other kids.
Why are you talking to me specifically, directly?
But isn't it true?
It's so true.
And then you're the one who becomes a manager. You're the one, like the way you have been groomed as you're growing up from home. Like you're groomed at home, you're groomed in school
system.
You go through college.
Same thing.
And in college, by the way, you have to bring those transcripts home because you cannot be failing. You already set yourself up to be a brilliant kid. And then the people who are likely to mentor you, or the people you're likely to be a protege of, are also people up there with big names, right? Case in point, your family. You follow in those footsteps. You're carrying that name. That you cannot fail that name.
True.
You get?
True. You have to keep showing up.
what happens
in fact,
is...
not just showing up, but outstanding performance each time you show up.
Exactly.
Yeah.
So you're groomed. What we are calling personality. You've been groomed that way. Notice how in every place you go, people mimic your family setup. Okay? When you're at work, you look around and someone reminds you of where you came from. Right? Even in group therapy, if you've ever attended, everyone mimics a family member.
Yeah.
So as you walk in, people are studying you,
Yeah.
and they already know the role you're going to play.
Yeah.
You already know that's the one who'll do all the work on behalf of the team.
Yeah.
That's the one who'll show us all the party places. That's the fun one. That's the one who doesn't work. That's the teacher's pet. It kind of starts to make sense. Like everything replicates what we've known growing up.
Right.
And we don't know how to shed that off. And we carry that into our adulthood, right? Such that you'll find people who, even after retirement, they're still pushing and pushing because
Right. Yeah.
we started that. We don't know if people will carry on with that. So we are holding it because your name cannot be associated with failure.
Yeah.
So there are many factors playing out, but our upbringings, they do a
Right.
number on us. And some of the things we admire in people, they're really trauma responses.
Right.
The over-functioning, the independence, it's how you coped growing up. It's what your nervous system knows.
Yeah.
And then that's what you come to know as being functional.
That's just your normal. In fact, you start to refer it as your normal.
As an adult.
Yeah.
And very few people pause to ask, could there be another way? It's very hard. But who is even allowing you to do that?
That's true.
You're successful now. You dare not fail.
You can't.
No.
You can't go back where you came from or, disappoint anyone.
Exactly.
Yeah.
And then now in the era of social media, everyone's good days are plastered everywhere, right?
Yeah.
Aren't they? They're plastered everywhere. I look at you doing surgeries and excelling. And I remember there's a time I was looking at social media like on a, when I was on that hiatus where I couldn't work. And in 1 week, one of my friends had gotten a huge job at one of the biggest foundations in the world. Another one had published a book. Another one had become a chancellor of a university somewhere in DC area.
Yeah.
Like there were just, someone else was on the 40 under 40.
Right.
And then I was looking at myself and thinking, man, I gotta
so
do
far
something,
behind. Yeah.
right?
Yeah.
I gotta catch up.
Yeah.
And then I was telling a friend, anybody who watches Friends, when people came home and Rachel was like, she's gotten a job in France, and someone else had gotten tenure, and someone else had gotten a restaurant, job.
Yeah.
And then Joey said, I removed a piece of meat from my mouth. Like that was his biggest thing.
His biggest achievement.
And I was like, that was my achievement. But you see what that does is because we have to catch up with the neighbors and our
to
friends.
Keep up with the Joneses.
Exactly. Keeping up.
Yeah.
It gives us so much pressure. And while being, having all this digital exposure is nice because now it has made it easy to connect with everybody.
Yeah.
We are so connected, yet so isolated. And
That's
facing
actually a
loneliness.
very good way to say it.
Yeah. So that it's become it's become a
super
public health
isolated.
crisis.
Yeah.
Because a lot of these people, you know them on screen, but you don't really know them, do you?
We have a lot of parasocial relationships now.
Exactly.
Yeah.
Parasocial is a good way to put it. So who are you connecting with, and who are you sharing with, and who are you identifying with, and how do you know you're not alone?
Yeah.
Because you're not alone, actually.
Yeah.
So there's all these factors at play. I mean, I can just name those few, but there's so many factors at play, and it never stops. It's like a loop that keeps playing. There'll always be, tomorrow there'll be a better car. Now everyone wants to buy a GLE or whatever.
Yes. Yeah.
But next week there'll be another car, right?
Yeah.
There'll be another car, and we will want to keep up with that. And we have to be seen as people who are going on and growing and growing and growing. So you see how difficult it is.
So it becomes a vicious cycle.
Yeah,
basically.
it just looks like you're doing so well, and nothing wrong with doing well. I admire people who do well.
Yeah.
I'm just saying, while at it, let it not be a facade that we are seeing when you're dying inside. So there are all these things, and you talked about some of the conditions that come with it, because when you ask how do we get there, you talked about bipolar, bipolar, where people have all these months of high productivity and then hypomania. We're like, he's not producing anymore. But nobody is seeing that as a mental health issue that's coming. Or depressive crashes, where your personality changes all the time. We misread a lot of these things as work ethic. They work hard. It's just that because they've been working hard. But then there's a lot of severe depression at the workplace again.
True.
And then the high suicide risk because, capability remains intact, that you are working to the last day of your death. Right? And then we also have people who have OCD. They just have hidden rituals. They have intrusive thoughts. They have this hyper responsibility. Everything is so well organized. Reports are done this way. And we don't see the problems that come with that. We just think they're very helpful. Or ADHD. Right?
Yes.
A lot of people are learning about their ADHD in their adulthood because it's been masked by intelligence and your ability to just work and hyper-focus. And then you have burnout cycles where you're out and then you hyper-focus, right? And you have a lot of emotional dysregulation. We think it's because you're tired. But how we also get there is because a lot of severe conditions in high-performing individuals are, like, intelligence can camouflage pathology for years. That's what it is.
Right.
Yeah.
Right. I like that we're tying it into the intelligent person, because a lot of high functioning professionals are very, very intelligent, top of class, like you said, high performer throughout. They've been raised a certain way and they're productive and they give you top notch outcomes. And so you think that because they are such a good performer, or addition, because again, as a performer, you're being paid well as well, the assumption. So then you're also a good provider, then you must be okay. And we do see this as well, not just in women, but also in men. And I feel like women tend to have a few more support systems socially compared to men. So we'll start to see issues like if you're poorly coping, we'll see it being masked with substance abuse, which we're seeing a lot more of, especially now in I can speak to Nairobi, but I'm imagining it must be the same in other areas of the country, where we have, for some reason, increased access to substances. I didn't even know what they looked like until very recently. We read about them in school, but I've started to see them.
You were not allowed to even know how they look like.
Now it's just literally available. Everybody has a dealer. Everybody has a dealer. And we're not talking about addicts in the sense of they're homeless, or you're sitting in the streets, or you're dirty, you can't look after yourself. This is somebody who shows up
it's
and
a surgeon
performs.
who needs to have their puff before.
Exactly.
And because we don't look like what do we call them? The stereotypical.
I don't look like a user.
Exactly.
Yeah, I don't have marks in my arms. I don't have blood nosebleeds because of snotty or whatever. Yeah, I just show up and
outfits.
Some it's alcohol as well, so not just substances. We have different drugs. There's no need to go into too much detail here. I'm not teaching anyone how to use anything, but there's lots of different drugs. There's alcohol abuse as well.
You don't want to give us a tutorial?
I feel like also I'm not the one to comment, because I think people have become professionals in that by themselves.
Exactly.
But it's not your typical, I'm worried about my child because they are a druggie. They're literally, they'll tell you, I'll have lots of patients. Because now as doctors, we take the history different. We have to ask about substances.
Yeah, and social history also.
Exactly.
Yeah.
And they'll come and the statement will be, I will smoke up to do XYZ. For me to do this, to eat, to sleep, to focus on a project, I need a substance in order to perform. Or maybe not even an illegal substance. Sometimes it's prescription medication that's being abused as well. Then we've seen an increase in self-harm, as well as now full-on suicide. It's become the question you have to start asking yourself, how can someone this brilliant not be able to cope? Or why didn't they speak up? Why don't they come out for help? Because it's usually very shocking, because like you've said, top of iceberg, I look like, I'm performing at Pro Max. Down here, not so much.
Yeah, but you see, when we ask, how can someone so brilliant, XYZ, or why didn't you? I feel like that question would be quite problematic, because it attaches something moral to it, or quite judgmental. When you're used to being high functioning and very intelligent, you're the one who guides everybody.
Exactly.
So who are you
Everyone
supposed to look to?
you. So
but also I'd
to?
ask, what has happened that your nervous system is unable to regulate itself naturally, that you need something else to do that for you. And we do outsource nervous systems. I mean, that's why, for example, you will not be okay until Eric is there. You've seen that happen with people.
Yeah.
And you'll keep asking, how can someone so brilliant not leave that relationship?
Yeah.
They have figured out a way to outsource that person to regulate them, however dysfunctional, but that's their way of coping, okay?
Yeah.
So when people use alcohol and stimulants and sedatives and cannabis, but we are missing other aspects that are not substance use, but I'm sure if we package them, they'd become that.
Right.
It's overworking itself because you don't want to deal with life.
Yes.
It is doom scrolling. When you're like this all day, it's numbing, right? It's the same as a drug.
Exactly, yeah.
Right? Or the screen, like you're just vegging. You're vegetating there in front of, you're watching Netflix,
your favorite
but you
show.
don't even know that you're watching.
Yeah.
It's just background noise, because if that noise is there, you don't have to listen to the noise up here.
Yeah.
It's also excessive gymming, excessive sex. There's a lot, but then what people miss, because we say, oh, that's a party girl, they love wanapenda raha, these guys have
mood.
exactly. But let me just say, what we miss is that this numbing and medicating and all substance use, whatever it is, it's really about pleasure. It's about relief, and we miss that bit a lot, and we think people are just doing this for the sake, but you've lived 3 years of carrying everybody. You're carrying the burdens at work. You're doing, there's so much, you're over functioning basically.
Right.
This hyperfunctional person, their brain is always, jumping up and down.
Yeah.
At what point do the brains now come and
let's
calm?
shut it down and calm down,
right?
Yeah.
So people go on these benders, but it's not because they're enjoying them. In fact, the next day people say, sitalewa tena. We hear that often, and we think, because they went through that and their bodies punish them, they're not gonna do it again. Until Friday or until Wednesday or until the next time someone yells at them at work. That's why I'm saying it's really about pleasure. That numbing, it's about just shushing the nervous system so that it can calm down, because they don't know how to regulate it.
Right.
And then finding some relief there. Okay, so it's a very tricky balance. Even in approaching these issues, you have to be trauma informed enough to understand what has happened to this person. What systems did they grow up in? What systems are they currently operating in? What does the environment look like? Because we could be trying to fix you and sending you back to the same place.
And the triggers are the same. And
the triggers are the same. And then we keep thinking it's lack of discipline or this or that. Really is addiction about just wanting to have fun. In fact, that's more the exception than the norm. For most people, is that their minds have to stop racing and they have to be calm, or they need the noise to just not address this. And it's a very tricky place to be in.
So now for
a bit of empathy towards that is
way.
required. Yes.
So what does help look like for someone like me? For a high performing or highly functional professional who is very intelligent, and so you say to me, then you need to cope with the struggle that whatever is the issue or the underlying cause, you need to cope with it. We are always told, go to therapy. But the thing I know about someone like me is I will intellectualize therapy, because I already know what the problem is. It's even worse for a medical provider.
I know, actually, it's true.
I even have it on a diagnosis level. I know what the diagnosis is. I know exactly what I'd tell my patient to do in order to cope. I know exactly, even medication-wise, I can self-medicate very efficiently. I know how to not just intellectualize the problem, but also perform when I come to therapy. I will sit with Mwari and I will tell her exactly what I know she needs to hear, or I think I know she needs to hear, in order for her to say, you're good, you're fine. So talk therapy, I think, is a little bit problematic for someone like me.
You're not wrong.
But that's the only form of therapy I think we tend to know. So how do you...
From the movies, right?
Yeah. I know I'm supposed to come and lie on the couch. In fact, I feel like that's what today is. I'm literally over here waiting to get my own medicine served back to me.
Yeah. But you know, by the time you're looking for help, it's because, for most people, it's because they're now at the end. Because, you know, we do have stigma.
Yeah.
We do have a lot of it in isolation, because if I disclose to you and you're my boss and I come and tell you I have a mental illness, right?
Yeah.
We equate that to career damage. You're like, if I tell them I have this diagnosis, that's the end. In fact, a lot of people will even tell you, don't write that on the insurance form.
Yeah.
But I'm like, this is medicine. They will know.
They will know exactly.
Yeah, nobody will give you this for flu. You know?
Yeah.
I can just write anxiety because you think that's a very mild thing, right? We think that if we disclose, that's the end of everything. So we perform wellness. Even perform wellness for your medical providers, so they don't write anything in the report that could get you.
Yeah.
You understand?
Trouble, or to get you either to have there's less respect in the office space. Sometimes you can actually lose the promotion or the job that you have.
But people will treat you differently.
Get promoted or get treated differently.
Exactly.
Or sabotaged and end up losing your job altogether. Yeah.
So we end up performing wellness for everybody, including your clinicians. And, you know, the fear of losing credibility, even within family members, the fear of being seen as unstable, if you've always been the stable one. In fact, we've had people who say, you know, if you get sick and you're the one who carries the family, what will happen?
Yeah.
You go and tell your parents I have depression, and they're like, but you're the hope of this family.
Yeah.
If you get sick, what will happen?
What will happen to
and their stress is not that you're even sick. It's now their security is gone. You're the one who sends a monthly stipend.
Yeah.
Or the leadership expectations on you, whether at home or at work, the cultural stigma that comes with naming certain... I mean, if you say I was diagnosed with bipolar 1, people will say, that's like bullshit. You know, there's a lot of... And people say, no. I mean, even parents don't want to hear their children have certain diagnoses.
True.
And so the more you hide, the more isolated you become. And isolation, as we know, is one of the biggest predictors of mental health decline everywhere. So when people come to therapy, people now like this, the high-functioning ones, the highly capable people, the ones who have it all together, they arrive having already intellectualized and analyzed themselves, okay? So they'll come, they'll tell you, yeah, like I know I have... I mean, they'll even use therapy speak. These days, you do know we have TikTok therapists. So people say, yeah,
we've all
I
become
realized
professors of therapy.
I have an I have a mother wound or a narcissistic something, or they'll use words and I'm like,
what's your training?
That's not even a diagnosis. You know?
Yeah.
And I can understand, because when you feel like you're losing control, you have to gain some of it back to keep pulled together. And intellectualizing everything is one of the ways to regain control, because I don't have to use my emotions there.
Right.
What can I do in the next 4 weeks to be okay? Therapy does not work like that. In fact, you cannot even give me a timeline. It will take as long as it takes, and people get impatient and they're like, I'm looking for another therapist because... And I'm like, that's also okay. But then when someone like that arrives to therapy and you realize that this is who they are, this is what they know, you easily see how talk therapy can become another form of control. Because also, it's like playing chess. They're waiting for you to reflect something, and then they come at you with something else neatly packaged. And I'm not looking for that. And that you can do with a book, you know? So the number one thing is to slow them down.
Okay.
Just because you have insight doesn't mean you're integrating it into anything. And integration is important, okay? So I have to move from the head to the body. So what does that look like? Somatic awareness, for example. You've heard of somatic experiencing, somatic-based therapies. It's where we teach you to have somatic awareness. feeling things in your body. So, for example, if you're going through an exercise, we'll ask you to track as you're talking what's going on in your body.
Emotionally.
Like, yes, where you're holding it. Like, notice the tightness in your chest. Or, for some people, you'll ask, where's the restlessness? And finally, they'll say, it's my feet. But those people, they have been running around all the time. They don't know how to be still.
Right, yeah.
But they also don't know how to track things in their body. They know everything through here. So somatic work is basically letting people, because the body just keeps a score. Run it down, you'll know.
It'll shut down, yeah.
It will alert you. It has it fires a warning shot. Even before panic attacks, your body will have said something to you.
Yeah.
But most people don't know how to pay attention to that because it's just easier to use head knowledge.
Yeah.
Be more logical.
Yeah.
If I can write it down and I have my spreadsheets, we're going to fix it. So it's basically trying to help you track things in your body, and we're not forcing the body open because also we have to move at a pace of safety. But we're trying to build safety first, and then we let your system release all these things. So when something is more body focused, you're able to know and read your patterns. Because a lot of people, they just say, oh, I just keep having a running stomach. Migraines, I just keep having migraines. But you can tell at what point, what happens, what's usually happening when you're getting to the migraines, right?
Yeah.
And then we also have to teach them emotional language, because if you say, for example, people really do use lingo with us. I'm trying to see.
We come in having, kwanza now with the AI, we come in with all the...
And they even, people even share AI chats.
Right.
And I'm like, I don't know. I don't know how to tell you that this is a bit whatever. But the thing is, someone will come and say, so for example, I mask. I do. Like they're bringing me my lingo, right?
Yeah.
But then what's the emotional language? Because I need you to learn to describe your primary emotions. I'm sad. I'm angry. I'm happy. I have fear. Like, I want you to be able to name that. And then we can go into the secondary emotions where, for example, I'm realizing it's the anger is coming about because of the grief.
Right, yeah.
Because a lot of people don't know why they're angry. But also, they don't want to call it anger. They just say, I'm just, I have to do something.
Yeah.
They don't know what that energy is that they need to dissipate. And they'll say, but I don't know why I'm angry. It could also be irritation covering heartbreak, okay? It could be sarcasm covering hurt. You've hurt me, and now I don't want to. I'm just giving you comebacks.
Yeah.
Okay?
Yeah.
And you see people who are really witty and they know how to go about these comebacks. And they just come naturally.
Right.
But because they don't want to acknowledge what's going on because that's losing control. And then we also teach you nervous system regulation, how to slow yourself down, how to not drown in the emotion that's, over there.
Yeah.
How do you regulate yourself?
Yeah.
And this is, you'll be lying on the floor or the chair, wherever, but we go through it physically, teaching you how to do that.
Yeah.
And then we also challenge performance in therapy. Therapy is not another area to succeed in, and I don't really care if you succeed in therapy. I don't care if you cried, if you cursed. Bring yourself. Let's work with what you have.
Right.
But a lot of people, they also come ready to perform for you.
Yeah.
You give them reflections, they're done that day, they're done perfectly, they have everything nicely written, anything you'd like to hear about someone who is doing well. Therapy is not another place where I need you to perform and be excellent in. I really don't care. If all you did was come to the chair and cry that day and ugly cry, that's enough for me because we are going somewhere.
Right.
But if you come ready to perform, there's not much I can do for you.
True.
But then also we have to work with shame in a very careful way because high functioning and highly excelling people, they have shame around vulnerability. And how to address it and confront it is a bit tricky, you know?
Yeah.
Because also you don't want to come at somebody in that way.
Yeah.
So how do we do it carefully? It's like disentangling something gently. And we also have to rebuild relational capacity because a lot of people, don't have that relational capacity. They don't have people to rely on. They don't know how to ask for help because they've never had to ask for help. They know how to dish out the help. In fact, it's a no-brainer.
I feel like the fact that you're talking to me directly is crazy.
So there are many other ways to do therapy. I mean, we also have EMDR, which is emotional, which is eye movement, desensitization, reprocessing. It's, we play with the eye pattern, but then there's a way your brain stores information and you have certain emotions around that information.
Right.
So like a traumatic event happened and every time you think about it, it throws you off. So it's just going through that, reprocessing it, and then helping you have a different emotion around it, almost de-escalating it. So whenever you remember the traumatic incident, the way it affects you now is not the way it would affect you, for example, before then.
Yeah.
We also do narrative therapy, rewriting, because a lot of high-functioning people, the problem is they sort of have an identity contract. I'm only valuable if I am high-functioning. And then what we are doing is just separating your identity from all these other things.
Right, yeah.
So I'm not trying to collapse your ambition, but we can hold space for what you have suffered through while excelling.
Right.
So how do we do that and how do we separate you? In fact, we even teach that language where you don't keep saying, I'm an anxious person. I'm a person experiencing anxiety. So the narrative has to change a little bit there. But we also do art therapy. Like, I love doing art therapy. I make people, I make adults do art therapy, I do that.
Yeah.
You've been a victim of
been
it.
A victim.
Yeah. I mean, and to go back to the narrative therapy, it's to remove self-punishment. That's what we do.
Right.
But with art therapy, it's just and symbolic work, because as you draw, there's so many things that come across, and they're symbols of something. If I look at something you've drawn, it will tell me a lot about your thought process. Right. So it's basically a way to bypass the overthinking, which a lot of people do, and allowing the deeper psyche to play out through symbols, through images, through texture, through metaphors. And you'll see people draw sometimes things that are very beautiful but very painful when you look at them.
Yeah. Or
things that just opens, like their lives are wide open and you never saw it coming.
Right.
So in all these forms of therapy, because they have a purpose, the work is to honor the parts of you that succeeded, but to make space for the parts of you that have suffered, that have been injured while you succeeded, the parts that nobody sees. And if you can bring those to therapy and ditch the performance, that would be nice.
Right.
But then also a lot of therapists and professionals don't really notice.
Right, yeah.
And
that was literally going to be my next question.
Okay, and then you listen
because first of all, thank you, because I've learned so much today in terms of other forms of therapy. Because
and that's just a
television.
Tip. There's so many.
Television shows me go lie on a couch and talk about your feelings, and after an hour or 45 minutes, go home with a bit of an assignment, and so somehow I'm going to feel better. But again, as an intellectual, I'm like, to what end?
Exactly.
Right? That's the first question that comes to mind. And then also, why am I telling you my things? Like you said, I don't know how to ask for help. That's standard setting. So now you want me to come and be vulnerable? Why? That doesn't feel natural. In fact, if anything, like you've said, I will perform my wellness. In fact, at some point, both of us would be confused why I'm sitting in front of you. So then the next question becomes, how do I identify the right therapist for me? Because it's not as straightforward, like you've said, as me coming in and what I'm saying is what you take as surface value to be exactly what you should be looking at in this individual as a therapist. So maybe it's not one size fits all when it comes to therapists for high-performing professionals. Maybe then talk us through some of the things we should be looking for, because like we've said, I've probably identified I have a problem. I know that I need to find a solution outside of whatever coping mechanisms, probably unhealthy ones I'd already started on. But even when you say therapy, I'm already looking at it as this thing will not help me.
Exactly.
But if I did want to explore therapy, what kind of therapist should I be thinking about? Or what traits should I be looking for in a therapist?
Yeah.
Yeah.
So, and not just a therapist, it's any clinician really. I mean, even a gynecologist,
Right.
you know,
Yeah.
because there's a lot of safety needed there. There are nuances, there's context to things. A lot of diagnoses are not just physiological.
Yeah.
There's a lot going on there. In fact, that's why things are collaborative, isn't it?
Yeah.
So anybody really, just look for somebody who is comfortable with high achievers. Whether you're the King of England or the President of Kenya or some big shot CEO, I need to be comfortable with that and not be performing for you.
Right.
Because you're here looking for help, isn't it?
Yeah.
And a lot of these people are coming to you because there's nobody else to tell. They're the ones who are told. So I need
That's true.
somebody
Yep. Yeah.
to help me process this without... I don't want to be president here today.
Yeah.
That's not why I'm here, right? So also you need to get somebody who has this non-intimidated presence, because Claire, whatever you're doing, you've come to me because I'm the professional.
Right.
Today you ditch your ears,
Yep.
and I'm the one now
Yeah.
listening to you.
Yeah.
But there are people who, when they see you, they're like, oh my God, it's
Yeah. Oh my gosh.
Princess
What do I do?
Diana, you know? And also, you don't want a yes man, someone who agrees with you. In fact,
especially that.
what happens is that I'll look at you and I'm like, you know, Claire has 2 million followers. I could easily be cancelled today.
Yeah.
So how can I challenge or confront her without being cancelled? Right? And you'll find a lot of people, you know, it's like when you're using AI and you're learning it, it just agrees with you.
Yeah.
It's like...
Yeah.
I'm like, therapy is not supposed to create this self-absorbed, narcissistic human who, I'm just yes man, I killed somebody, okay. You see, you were justified in doing that because... I need to be able to challenge you and confront you. Gently, of course, but I need to do it. But also, you need someone who has experience with complex diagnosis, right? Because sometimes something could be clinical, but you're seeing a non-clinical person for your therapy, and they don't believe in medicine, or they don't believe in this and that, and then it takes so long for you to recover. But also, you need people with strong boundaries. You need to find someone who is trauma-informed, who is inclusive, because we do know people who you go to see them, and the moment they know what your identity is, everything changes.
Right. Yeah.
There's judgment in the room. They want... I mean, and people come to us with a lot of things. I'm having an affair, and they're already being judged out there. But you've come to me as a therapist. I'm not your pastor.
Yeah.
Let's talk about it, right?
Right.
So you need to ensure that the person you're seeing is trauma-informed. They're constantly growing. They're also going to therapy for their own shade, hopefully. But the most important trait is coming across a mental health professional who has the ability to hold brilliance and brokenness in the same room, because you can live in duality. You can be excelling and dying, right?
Yeah.
So I need to be able to hold both
Yeah.
in the same room, not be wowed by that or drained by this. I need to integrate both, and I need to work with you as you are. So there's so many other things, because you're actually coming here because there's a lot you're wanting again to rewrite, or there's some reparenting you're needing to do. So the person you're seeing needs to have the ability to do that.
This is heavy, because again, it's becoming more and more that every time I have you in here, it feels like it's a therapy session for me.
Oh.
In as much as we're also learning with the audience, it starts to feel like, am I taking notes? Can I take notes over here on the side? But I think the messaging here is find a safe space. You're not used to asking for help. Find the right person so that they can help you get help. Because I think some of it will be that they identify and help management.
But see, the thing is, for you now, let's say you're coming to get help. Because you live here, the thing you feel in your body, you're not so familiar with what it is.
Yeah.
You do know there are people who, they don't know why. When everybody goes to carnival, they look happy and excited. It's a symbol of joy and fun.
Yeah.
But when you're there, everything feels chaotic.
Yeah.
So you get to a place where you rationalize it, and tell yourself, maybe I'm just out of sorts.
Yeah, this
So
is not for me.
The point is,
Yeah.
the place does not feel safe for your nervous system.
Right.
But you're not having those cues to let you know. Actually, we call it interoception, having internal cues to, like, knowing this, I'm feeling this way because I'm anxious versus I'm feeling this way because I'm hungry, you know. A lot of high functioning individuals with all the masking don't know that.
Yeah.
So it's the same with therapy.
Yeah.
Your nervous system has to feel safe. I mean, you do build rapport, and it's a long-term relationship, isn't it?
Yeah.
But now you need to know if you're having hang-ups because there's some loss of safety, or you have to perform for this person because they're going to judge you for all the things you did during the weekend.
Yeah.
You know, before they saw you.
Yeah.
Identify that, and if you're feeling judgment and like the person is moralistic or reducing things to black and white, it's actually your cue that you're not going to get help there.
True.
Yeah.
True.
You don't have to go through primary school experiences where there's punishment and needing gold stars. And it's a mistake that a lot of adults make.
Right.
And that's why you're doing it at work, but you're also doing it when you see your doctor.
Yeah.
And you're doing it when you see your therapist.
Right.
Your doctor, your therapist, actually anybody in the helping profession who is seeing you because you need to address something going on with your mental well-being, with your emotional well-being, with your physical well-being, they need to be trauma informed. They need not impose their beliefs on you, and they don't need to be grading you and your performance. Right? I mean, even in the gym, if you have a coach who is trying to make you do that thing over there that person has taken 20 years to get to, and they're not listening to you, this is to be safe, isn't it?
True. Very
so
true.
Every morning when you wake up, you're going to the gym, but you're feeling...
Yeah. In fact,
You know,
you're so
that's
sore
really-
from whatever torture you went through the previous time. You
Exactly.
can barely perform
And
on
then
whatever new thing they've set up
you
for
drop
you.
off.
Yeah.
Yet, what's the job of a coach? It's like mentorship. They're walking you through the process and being gentle with you. Will they push you? Of course.
Yeah.
They'll push you. But they don't need to degrade you or berate you or belittle you while at it. So anybody who is taking care of you, like any part of you, is supposed to be gentle with you. Will they confront? Sure. Will you fight? Sure.
Yeah.
But at the end of the day, the key word is safety. They need to be safe for your nervous system. If every time you live there, you feel like worse than you came, and not worse than you came because of the problems you're talking about, but because of seeing them, then you need to know that's not your place.
Right. Right. I think I will leave it at that. I feel like this has been a fantastic session. First of all, just to help a few people recognize what they might not... They know something is wrong, but they're not able to put it into words. So hopefully watching this episode just stimulates that awareness, so that then you understand that there is a problem and you do need to find some help, and maybe looking into some of the coping mechanisms you've been leaning on and whether or not those are actually healthy versus should I actually be looking for professional help as well. And then in looking for professional help, what is safe and what is not. And I think that's that for today before I start to get emotional. For anybody watching who feels or listening who feels that this episode has brought up serious issues for you, we're going to put a lot of information on resources, including Mwari, in the description or in the caption, depending on where you're watching or listening to this. And I'll just reach out through the camera or through the mic and give you a hug, because even me, Niko hapo tu na wewe, please. Thank you so much for watching, for listening all the way to the end of this episode, and I look forward to seeing you on the next.